Do you know what type of forms and charts are usually given in the OSCE examination under the mental health and cognitive assessment tools? Hey guys, this is Rima. Welcome back to my channel. I talk about nursing and life. In today's video, we are going through the most of the common forms that are being given in the OSCE examination, such as MMSE, Mini Mental State Examination, RUDAS, K10, Kessler Psychological Distress Scale, Geriatric Depression Scale, and Cornell Depression Scale. I will explain when and how are these forms used, how they differ from each other, and how to apply them in the scenario-based questions with the script. These tools are the structured questionnaires or the rating scale that helps us to assess a person's psychological state, mood, and cognitive function. The main goal for the students for the examination is to complete the assessment accurately, document the findings clearly, and communicate the results effectively to the multidisciplinary team such as doctors, psychologists, team leaders, allied health, and with the patient if it is appropriate. Disclaimer: this video is for the educational content only, not a diagnostic guide, and it is solely based on my own knowledge and experience, so please also do your own research. Let's start with the number one form, MMSE. Its full form is Mini Mental State Examination. It is used to assess the cognitive function. Things like orientation, memory, attention, and language are examined here. It is typically used for the older adult population and the adult with the cognitive deficit. The common OSCE scenarios that may come in your examination is new admission, or when a patient shows a new confusion, getting forgetful, or there is a concern about the dementia or cognitive decline. The MMSE has a total of score 30, and anything below 23 or equals to 23 may suggest cognitive impairment. Each question scores 1 point for correct answer and 0 for incorrect answers. This is a quick, structured, and helps the nurse to identify if further neurological or medical assessments is required. As you can see in the form here, there are 5 domains. Number 1 is orientation, number 2 is registration, number 3 is attention and calculation, number 4 is recall, and number 5 is language. So in each domain there are different kind of questions. For example, in the first domain it asks about the year, date, day, month, season, whereas it also asks about the full address such as country name, state name, suburb name, city name, place name, hospital name, or aged care name, whatever, wherever they are. And under the registration it gives you the name of the 3 objects and asks them to remember it, and you will ask it later. Whereas in attention and calculation it will give you the word, spell it backwards as well, and in recall it will ask you to remember all those 3 words that you gave and then ask them to recall it. In language you will test if they can read a sentence and do the action what they have been asked to. Ask them to draw a picture that's similar to that of in the paper or in the form, and write the complete sentence. So the scoring is done at the end, and if the score is below 23 or equals to 23, then you will have them to refer to the further evaluation or interventions. So if you are going to the exam, make sure you read the form thoroughly so that you can ask the questions easily and you won't get stuck in between. Let's talk about number 2 form, which is called RUDAS. RUDAS full form is Roland Universal Dementia Assessment Scale. This tool also assesses the cognitive function like that of the MMSE, but it's designed to be more culturally fair. It is particularly useful for those people who have non-English speaking background or is multicultural patients, where language or education may affect the MMSE examination. The RUDAS also looks at the 6 domains such as memory, body orientation, praxis, drawing, judgment, and language. It also takes about 5 to 8 minutes like that of MMSE if you are already familiar with the form. It has got a 30 questions in it. Each correct answer will be given 1 mark. A score of 22 or below suggests there may be a cognitive impairment, which is kind of similar to the MMSE. The OSCE scenario would that also be similar of MMSE. However, in here, the person may be from the distinguished culture or have linguistically diverse background. If you refer to this RUDA score here, you can see it also measures the memory. So in MMSE, we used to give them the 3 items to remember, whereas in here we will give them the list of the shopping items so that they can remember it later. For the orientation, we will ask them to identify their body parts, such as show me your right foot, show me your left hand. And for the praxis, we will ask them to do a motor function. We will show them what to do and then ask them to repeat it. And it also have a visual constructional drawing. In the MMSE, we ask them to draw the pentagon, whereas in here we will ask them to draw a box where the inner corners and the external corners will be counted. Here the judgment is also checked. In judgment, we will give them the scenario where they are in the traffic and we will ask them what they will do to be safe. Similarly, in the memory recall, we will ask them to remember all those shopping lists that we give them earlier. Lastly, for the language, we'll ask them to name the 8 animals within 1 minute. So it's kind of similar to the MMSE, only the questions is not that vague and it's straightforward. Let's now move to another form. The third form is K10, Kessler Psychological Distress Scale. It is a self-reporting scale where a patient will rate themselves on 10 questions. Here you can also see this scale will help us to measure the psychological distress, mainly the symptoms of the anxiety and depression over the last 4 weeks. This form is pretty straightforward and can be completed within the 5 minutes of time if you are already familiar with the form. There are total scoring of 50. The score above 30 is considered as major distress and the 10 no distress. Here the higher the score, the distress increases. For the OSCE scenarios, it may come as the patient have reported the anxiety and depression recently, or you have observed the low mood, low energy recently. So you can use the scales in such scenarios. This form uses a 5 value response option for each questions. All of the time, most of the time, some of the time, a little of the time, and none of the time, which can be scored from 5 through to 1. From the examination point of view, in this form, it is important for you to remember the strategies and the interventions you will do depending on the scoring, because the questions are pretty much simple that you can just read out from the form and give it to the patient. However, once you get the score, it is important for you to know what kind of management would or should be done. So I have here given a new picture where you can see 10 to 15 is low, 16 to 21 is the moderate condition, and it has given the management such as referring to the consumer or GP, doing the case conference with the families, providing 1:1 reassurance, making a behavior support plan or referring to the care plan, similarly encouraging the person to maintain their routine and continue the family and friend connections, and speaking with the consumer, providing them the information about the support that they can get and providing them the lifeline number if they need. Whereas for the other scoring such as 22 to 29, which is considered high distress, and 30 to 50, which is considered severe distress. In such cases, it is important for you to inform the manager and the GP immediately and organize the after-hour GP to review the consumer. Similarly, commencing them on the sighting chart, vital signs, pain chart, and doing the urinalysis and confusion assessment tool is important. And if there is a threat to the self and other safety, it is very important for you to contact the emergency services. So it is very important for you to know this management before you go to the examination so that you can educate to your patient and provide the referral as required. Alright, that was easy. Now another is geriatric depression scale. This is the most straightforward scale that you can use. Here I have used the 15 item short form. It also comes under 30 item long form. This tool is used to screen the depression among the older adults. The questions are pretty much direct and you just answer in yes or no. Each yes will be given 1 mark, and at the end of the question, if the score is equals to 5 or more than 5, then it may indicate the depression and further management would be necessary. The scenario can be given as that of the K10, such as low mood or changing mood, low energy, showing the sign of anxiety or depression or new admissions. This is an example of the GDS form. Here you can see the questions are so direct and the answers are just yes or no. So that was pretty much straightforward and clear. So now let's talk about the last form, Cornell Depression Scale. So this kind of scale is used in the person who is already diagnosed with the dementia and can't accurately describe their feeling. Instead of relying on the self-reporting as that of the other forms that we use, here we use the more clinical observation and will get the information from the caretaker. This tool also assesses the mood, behavior, physical signs and daily functioning. You can also see the form here. In OSCE examination, the questions can be direct like, please do the depression assessment in a person who is already diagnosed with dementia. It may also come as the evaluation tool for those who have recently taken the medications or who have recently taken the management for the depression. In here, the score of 8 or above suggests there is a depression. This tool is very valuable in the dementia care settings. This form also have 5 domains on it. The number 1 is mood related signs. Here, anxiety, sadness, irritability is observed. Number 2 is behavioral disturbance where the agitation, retardation is observed. And number 3 is physical signs where weight loss, loss of appetite is measured and seen. And the number 4 is cyclic function where the sleep is also observed. And number 5 is ideational disturbance where the suicidal thoughts, low self-esteem is observed. So in here, there are 4 scoring systems. A means unable to evaluate, 0 means no symptoms, 1 means mild symptoms, and 2 means severe symptoms. So the scoring of 8 or more than 8 indicates that the person may have the depression. So these are all the forms that are important for you under the mental health and cognitive assessment tools. So it is important for you to go through the forms so that you can complete all these forms within the given time. Usually if you are familiar with these forms, then it will only take around 5 to 6 minutes for you to complete. Alright, now let's summarize the forms. So number 1, MMSE. This is a cognitive test for the memory and orientation. Number 2, RUDAS. This is also the cognitive assessment form which is done for the culturally and diverse patients. Number 3, K10, Kessler Psychological Distress Scale. This is a self-report distress scale for anxiety and depression. Number 4, GDS, Geriatric Depression Scale. This is the depression screening tool for the older patients. And number 5, Cornell Depression Scale. This is a depression screening tool used for the person with dementia. This form helps the nurses to collect a consistent evidence-based data for care planning, better communication, and safe person-centered practice. Remember, in your OSCE examination, it is not just about knowing your tool, it is also about how, why, and where to use the tool. Always introduce yourself, check the patient ID, explain the purpose of the assessment, obtain the consent, and show empathy throughout. If you are confused how you're going to use side by side the form when you are doing the communication with your patient, you can let the patient know that you will be scoring side by side while you are talking with them so that you can do the scoring at the end of the assessment and then provide the required education and referrals. Please also let the person know that they can stop the assessments anytime in between if they feel uncomfortable, because it is not easy to talk about the depression and anxiety. At the end, always share the result if it is appropriate with the person and provide the management and the referrals as needed. And always inform the doctors or the senior nurses as needed. If you found this video helpful, please don't forget to like, comment and subscribe my channel. Thank you for watching the full video. I will come with another video soon. Please don't hesitate to comment in my comment box if there's anything that you want to see. I also have an Instagram and TikTok where you can send me the message if you have any queries. Please don't forget to share this video with your friends and family if you like the video. Thank you for watching the video until the end and best of luck for your OSCE examination.